fingers. Okay, so now we're going to discuss the second part of the skull, facial bones. Relative to the cranial bones, there's a lot more bones that go along with the facial bones. So that includes the two maxilla, which is this area right here, and it's broken up into two different sections. You have the two cheekbones, the zygoma, the lacrimal bones, which is related to your tear ducts, lacrimal referring to tears. Your two nasal bones, so your nose also is broken up into two different parts. Two inferior nasal conchae, two palatine bones, one vomer that can't be seen externally, you have to look at the inside, and then one mandible. So there's a total of 14 bones altogether. The maxilla, the upper part of the mouth. There are three processes, and these processes articulate with other parts of the bone. So over here, the first process here is the frontal process, which articulates with what? Frontal process. Frontal bone. It's going to articulate with the frontal bone. Then you've got the zygomatic process of the maxilla that articulates with the
zygoma.
Okay, there's a zygoma, and then there's one more.
Second zygoma.
Okay, remember the zygomatic process of the temporal bone that forms the zygomatic arch. Okay, so this is going to eventually form the zygomatic arch area. So if you look over here, this is your cheekbone. Okay, so there's your zygomatic bone, and then here is the process coming from the temporal bone. So this area here is going to form the zygomatic arch. All right, we talked a little bit about the acanthion. That's where your nose attaches on the bottom. So this is the acanthion down here. The alveolar process is just the bony bumps where the teeth are inserted. And then lastly, we have the anterior nasal spine. And then you can, you guys can just look over which bones they articulate with. Again, we have a lot of slices to cover, so I'm going to try to be quick about it without giving up too much information. All right, so the maxilla has some sinuses. The sinuses are air-filled cavities. So those are one of the sinuses that we are going to be talking about later here. And then we previously talked about the three processes, but there are a total of four. We can see the three, the frontal, the zygomatic, and also the alveolar. But the fourth one is actually underneath, which forms the hard palate, of the mouth. So if I can just go here real quick and show you that. Let's see here, let's do multiple. Okay, hide others. All right, so when we look at this, so here are this is your alveolar process where the teeth attach. Okay, and then if you look underneath, this last part here is the palatine process of the maxilla. Okay, there's one more area over here that forms the roof of the mouth, and that's a separate bone that we'll cover later on. But that's the palatine bone that's going to cover the rest of the roof of the mouth. The palatine bone goes right here. All right, so here we have the roof of the mouth, the hard palate. That's the palatine process. And then right in the back of that is the palatine bone. It's a separate facial bone. It's the palatine bone. Okay. It's broken up into two different portions that I'll show you later on. There is a horizontal portion of the palatine bone, and there's also going to be a vertical portion. So when we look at the palatine bone, it looks like a goalpost in the football field. So you have the horizontal, which is this, and then it goes vertical. Right here at the bottom is the pterygoid hammerless, the hammer that comes from the sphenoid bone that you can see on the inferior surface. Okay, zygomatic bone, this is also known as your cheekbones. Let me see. We have the temporal process of the zygomatic bone, or the zygomatic process. Temporal process is going to articulate here with the zygomatic process coming from the temporal bone. The zygomatic prominence is the actual part of your cheekbone that sticks out. What else can I say about it? Not much. You guys can look that over. Not a lot to say. Okay. Cheekbone, zygomatics. But it is important, okay, maybe I should just say this. It is important that to know that the arch is formed by those three bones, okay? So it's going to be the maxilla, the zygoma, as well as the process coming from the temporal bone is what's going to form the arch. Okay, that you need to know. Okay, nasal bones. Nasal bones, you have a left and a right. It forms the bridge of your nose. If you take an x-ray of the nose, it's a very, very small bone. The rest of it is just cartilage. So whatever comes off of that forms the rest of your nose is just simply cartilage. Okay? The bone itself is just very small, very thin, that forms the bridge of your nose. And that's all I gotta say about that. Okay. Next one here is the inferior nasal concha, or conchae. There are three sets of conchae that warm and clean incoming air before reaching the lungs. We covered the superior and middle nasal conchae last week because that is formed by the ethmoid bone, which is part of the cranial bones. The inferior nasal conchae is part of the facial bones. Okay? So superior and middle is formed by the ethmoid, while the inferior is part of the facial bones. Inferior nasal conchae, turbinate, cell-shaped bone. Okay, Chris Gale. What are we looking at here? Okay, we're going to talk about this later on. We've covered this last week, so I'm going to talk about these bones on the next couple of slides. All right, the palatine bone. Here's the first image that we looked at. It's a horizontal portion. This is the roof of the mouth. This is the hard palate. And right behind the hard palate then is the horizontal portion of the palatine bone. And then when you look at it coronally, here's a horizontal portion, and it comes up, project upward like a, again, there's the perpendicular portion that looks like a golf post. And when you look at it laterally right here, this perpendicular or vertical portion is this right here. It's actually pretty cool. Here, let me just do this real quick. Let's go back over here to this right here. Let's hide those. Palatine. Can't see the palatine here. That's it. No, that's not sure. I think that's it right here. Yep. this is what it looks inside, how it looks like inside your skull. Am I the only one getting excited about this? Yeah, I go on my phone, I lock the doors.
Yeah, and that's what you look
Yeah,
at.
this is what I'm looking at.
Right.
All right. If you look at it laterally, okay, that's what it looks like laterally. You can compare that with the image down here. Yeah. Okay. All right, let's see. I'm embarrassing myself.
So what's your favorite facial bone to look at?
All right, the bony nasal septum. Bony nasal septum, and it's kind of written weird over here because see, it makes it look like the bony nasal septum is separate from this other bone, the vomer. But the bony nasal septum, if you look at the writing I put under here, it's actually formed by the ethmoid and the vomer. And the ethmoid and the vomer, the ethmoid is perpendicular plate, and the vomer, which is this bone right here, forms the bony nasal septum. Okay, so it's formed by those two bones. Okay, and so the vomer, when you're looking at it from front to back, anterior to posterior, it's a very thin bone that looks just like this. But once you flip it onto its side, this is what the vomer looks like. Okay, and the vomer is what's going to separate the oral cavity from the nasal cavity. You've got the vertical plate, you've got the ala, and I think I've got a better picture here. You've got the vomer, you've got the vertical plate of the ethmoid bone, and when you're looking at it in an x-ray, this very dense line going down the middle, this is the bony nasal septum. Okay, so again, the bony nasal septum is formed by the vertical plate of the ethmoid and then the vomer. Now this particular projection up here, this position is known as the P.A. Waters method, where the mental meatal line, that is your chin. Your chin is going to be perpendicular with the image receptor, like so. And when you do that, notice where the petrous ridges lie. They lie below the maxillary sinuses. So these are the maxillary sinuses here of the maxilla. So the petrous ridges lies way below that, and so this particular position, projection, view is very good for demonstrating what then? It's
Sinuses.
very good for demonstrating the maxillary sinuses, which we'll talk about later on. But this is called the Waters view. But it's also very good in looking at that bony nasal septum. Okay, the mandible. Lots of parts going on with the mandible. That's your jawbone. At the very top, we've got the coronoid process. We've got the condyloid process, or the head. And then this little dip right here is the mandibular notch. Okay, so we have the coronoid, condyloid, and the mandibular notch. And then the vertical portion of the jawbone, this is known as the ramus. Then we have the body. Your chin, or the mental point. This can also be called the, depending on which angle that you're looking at, this is the mental point, or it could be also known as the mental protuberance. It's where your chin sticks out, the mental protuberance. I did find a typo. I think on your slides, Jay was pointing to, what does your slide say? Mental point?
Symphysis
Symphysis,
mental.
okay. Yeah, the symphysis is over here. It's the division between the left and right side of the mandible. It's where they symphysize. It's right down the middle. Is the symphysis menti. So what this line is pointing to then is the alveolar process. The alveolar process of the mandible. Again, the bumpy parts of the bone where the teeth attach. And inside, right towards the front, the anterior portion of the mandible on the body is the mental foramen. This is where mental artery and the veins and the nerves for the lower lips and chin are located. Oh, one more. The angle. The angle. What's the angle of the jaw called? The gonyan. The gonyan. The gonyan. Okay. All right. So here we have the condyloid process, and this particular part is going to articulate with what bone? Okay, the temporal notch of the temporal bone, and what joint does that make?
TMJ.
The TMJs, the temporomandibular joint. Okay. All right, you got it. All right, so this is one of the projections that we do for the mandible. It's called an SMV, standing for, what does it stand for? Submental vertex projection, okay? So it's entering submentally and exiting vertexly. I'm starting to sound like James. I'm making things up. It says in the vertex. Okay. So the coronoid process, if you look over here, here's the coronoid, the condyloid process. And then if you look at it from this projection, the coronoid process is this. And if you look at it vertically, then it's right over here. Okay? So if you allow me to do this again, it's a lot easier. It's again a lot easier when you're looking at it three-dimensionally. Okay, so just bear with me. Okay, so you're looking at it like this. So this right here is the coronoid process. Coronoid process. And you look at it like this. That's your coronoid process right there. It matches the picture. Okay? And then this area right here is the condyloid, and this is what's going to form the TMJ. All right, so your TMJ is formed by the condylar process of the mandible. It sits in the temporomandibular fossa of the temporal bone, forming the TMJ. And it's funny because if you find the hole on your head, your EAM, you can feel it just right in front of it, your TMJs, and you can feel it when you open and close your mouth. You can feel this actually coming in and out of the fossa. It does move. It does fall out of the space when you open up your mouth. Okay. So here's the TMJ in motion. So when it's in the closed mouth, the condylar process does sit in the fossa, and then when you open it, the condyle moves forward to the front edge of the fossa. So it does move out and forward, and that's normal. Now, what's lockjaw? Have you guys ever heard of lockjaw? Yeah. So lockjaw is when it doesn't fall back into the fossa, it stays out. Okay? So because this only happens when you open up your mouth. Lockjaw, you can't close your mouth because it's stuck outside of the fossa. It won't pop back into place. Yes? You've had that? Okay.
This is a funny story real fast. When I played softball at Chapman, one of the older girls had lockjaw. My teammates would try to make her laugh while she was chewing, so then she would get it. so she couldn't close her jaw for like a while.
So they purposely had her. So how did she get it back into place?
I don't know how she did it. She figured she knew how to do it, but it would get stuck for a little bit.
Oh,
you know.
So she'd be
yeah
the entire time?
Yes.
Can I have her number?
I thought I was.
actually. Can I?
It was just like a joke between them. Like,
You know what? If I was your team members, I probably would be doing the same thing. Yeah. Okay,
she was
guys.
really sweet about it. So.
Huh?
She was really sweet though, so like she
Aw.
wouldn't like get mad or anything. She just like laughed.
That's cute.
Now makes you guys cruel, right?
Okay. We'll talk later. Joint classifications. Joint classification. Okay. So the sutures of the cranium, they are considered fibrous and synarthrodial, meaning that they don't move, right? Immovable. The teeth, the alveolar processes, they are fibrous and also synarthrodial. And then your TMJs, they are freely movable, they are hinged and also the gliding type. All right. By now you guys should you understand these terms, right? Synarthrodial, diarthrodial, ampiarthrodial. Okay. All right, the anatomy of the paranasal sinuses. There are 4 different sinuses. You have your frontal, ethmoid, sphenoid, and then you have your maxillary sinuses, and these are the locations. The frontal you will find in the frontal bone. The ethmoid you will find in the ethmoid bone. The sphenoid you get it? Okay, you see the theme? All right, so also be familiar with the orientation. When you're looking at it laterally, the maxillaries are pretty much obvious to, the maxillaries and the frontal are pretty much easy to identify. Now, when you're looking at it laterally, remember the sella turcica? Okay, what part is the sella turcica found in? Which bone?
Sphenoid.
The sphenoid. So here's your sphenosinus. The sphenosinus actually sits right underneath the saddle. Okay, so the sphenoid sinus sits right underneath the saddle of the sella turcica. And then just anterior to that is where you're going to find the ethmoid sinuses. Okay, the ethmoid sinuses. And then below that, you'll find the maxillaries. So it's always good that, again, you need a starting point, some kind of base point. If you know where the sella turcica is and it's easily identifiable in a lateral skull, right below that is going to be the sphenoid, right anterior is going to be the ethmoid, and then right below that is going to be maxillary. Okay? So it's always the good starting point is that sella turcica. Okay, so I guess here's a better picture. So there's the saddle. There's the sphenoid, right anterior to it, ethmoid, and below it is the maxillaries. Now, in the anterior, AP or PA projection, the ethmoid sinuses and the sphenoid sinuses are going to be, if you look at them, they're in the same plane, right? So if you're looking at it AP or PA, they're going to be superimposed, but they're generally at the same level. Same level, but they're going to be superimposed. Okay, so here's the ethmoid, which is more anterior, and the sphenoid is going to be right behind it. Okay, so the maxillary sinuses, you have 2 of them. They are within the maxillary bone above the upper teeth. And again, the importance of when you are taking x-rays of the sinuses, the importance of it doing it upright, so we can detect air and fluid levels, right? We prefer to do it upright. If there are air and fluid levels and they're laying down, you can't see it because the fluid will just spread out and fill out the cavity, so you won't see those levels. Also, take a quick look here. You will see how closely the roots of the molars in relation to the maxillary sinuses. So if you get a tooth infection, guess what also you're going to get? A sinus infection.
We shot an x-ray on this lady who had an implant, and it went, the dentist went too far and went into her sinus, and she has continual sinus
Oh,
issues.
wow.
It
And-
broke the
Oh,
barrier.
that's too bad. And they can't fill that area up with cement or anything like that?
I don't know, we just saw it on the X-ray,
Okay.
where the implant went into the
Right.
sinus.
So is that why she was getting the x-ray done, because of that?
Because of her, they didn't know.
Oh.
She was having sinus issues, and we saw that when we took.
Oh, so
her.
they didn't know
Yeah, Steve.
prior to that.
Steve was like, well, you see this implant she has here?
Mhm.
It's very possible it's reaching into her sinus, causing her these bacterial problems.
Right. Yep. Okay. All right, the frontal sinuses. We have the inner and outer tables of the frontal bone. They are rarely symmetrical. Some have one, some have two, some have three, and some they don't even have a frontal sinus. Okay, but they are asymmetrical. They can come in different patterns, and again, they may or may not be there. Okay, found in the frontal bone of the cranium.
So the word tables, what exactly it refers to?
The inner and outer
Tables.
tables of the frontal bone is just talking about the borders, it's just the
Okay.
border of the frontal bone. Yeah. Talking about the outside, inner,
The border.
yeah, the borders. Okay. Ethmoid sinuses. Ethmoid sinuses found in the ethmoid bone within the lateral masses of the ethmoid bone. They communicate with the sphenoid sinus and also the nasal cavity. And so between the ethmoid and the sphenoid, the ethmoid sinus is going to be more anterior. Okay, they're going to be here, and again, right behind that is going to be the sphenoid sinus, right below the saddle. Sphenoid sinus, right below the saddle. Now, this is a good anatomical structure to study, because if you look over here, the sphenoid sinus is surrounded by bone. Okay, surrounded by bone. So if we took a lateral and then we see fluid levels within the sinus, that's a good indication that there's a basal skull fracture. The base of the skull, which is right here. When you think base, you think it's back here, but the base is actually the area that separates the skull cap from the floor of the skull, and this is the floor or the base of the skull. So if there's fluid leaking in there, there's a good indication that there is a fracture in the base of the skull, a basal skull fracture. Okay, so communication between sinuses and nasal cavity. So the communication provides drainage between the sinus cavities, that includes your frontal, ethmoid, and maxillary sinuses. The communication happens within the nasal meatus, right here centrally. So this is where the communication or passageways occur. And I think there's a better, yeah, here's a better one here. So again, we're looking at it from anteriorly, it's a coronal view. The ones that you need to be familiar with, the key passageways is the ethmoid bulla, which receives fluids from the frontal and ethmoid sinuses. And then you have the communication in the infundibulum, that's a communication with the maxillary sinuses. So those are the two important ones that I need you guys to be familiar with. Everything else, not a big deal. But it's the ethmoid bulla and the infundibulum. All right, so here we have a couple of x-rays. One is a lateral, the other one is a PA Caldwell. How do we know that's a PA Caldwell? The What's your main criteria? Which-
Petrous ridges.
Okay, so you have the ridges filling in the lower third of the orbits. Okay. All right, so if we look here laterally, okay. What's this?
Salatur.
Saddle. So this then is what?
Sinus, sphenoid, sinus.
Okay, so it's going to be the sphenoid sinus, and then anterior to that, this area right here, that's your ethmoid, and then right below that,
Maxillary.
maxillaries. Okay, what else are we missing? What's that?
Frontal.
That's your frontal. Okay, now if we go over here, the frontal sinuses are really faint, but you can see the outline. Here's your frontals. This dark area over here is going to be the ethmoid and the sphenoid in this one area, and then you have both maxillaries. And this is why this particular view isn't good for analyze. This is good for frontal sinuses, right? Because the P.A. Caldwell, what does the P.A. Caldwell use for the skull, for the cranium? What are we doing that for? To look at the frontal bone. So this is also good for looking at the frontal sinus, but not good for the maxillaries because you got the petrous ridges right over the maxillary sinuses. So if I needed to get those petrous ridges out of the way to evaluate the maxillary sinuses, what do I need to do? Chin down or chin up? Okay, here are your petrous ridges. Do I want chin up or chin down? Chin up. Remember the Waters view we talked about, where they were like this? Okay, it's going to bring those petrous ridges below the level of maxillary sinuses. So to evaluate that, then we would do what's known as the Waters view. It brings down the petrous ridges. Actually, these should actually be moved over. Sphenoid's right here, ethmoid's right here. Is that something I could fix? Can I fix those? I can't fix it. Okay. But you guys have the general idea, right? The ethmoid is always going to be anterior to the sphenoid. Yeah, this should actually be right about here. It looks like, yeah, and then the ethmoid is actually right here. All right. All right, this is a Waters view. A Waters view. So this is Waters, mental meatal line, perpendicular. All right. So it drops the petrous ridges below the maxillary. But this is a special type of Waters view. It's actually a open mouth Waters. So they're doing this. Okay? Because the sphenoid is going to be hiding behind the teeth. We have them open up their mouth to visualize the sinus in the open mouth. Okay? And now you've got the ethmoids projected through the nasal cavity. And A, what's A? We already have an M, so they have to give it another initial.
Mastoid.
It's your mastoids. Okay, so the A is your mastoid air cells. All right, SMU projection. You're not going to see the maxillaries very well in this projection. They get burnt out. But they are there. There may be some superimposition. So again, we're looking from the bottom up. The ethmoids and the sphenoids are presented. Remember, the ethmoids are anterior. Okay? It's anterior. Sphenoid is posterior.
It's going to be superior.
So here is your ethmoid. And if you look, how do I know the ethmoid? I'm always into Disneyland. You guys see Mickey Mouse in there? Mm-hmm. Those are your ethmoid sinuses. Mickey Mouse. Okay? And then right below Mickey Mouse, you have the sphenoid. B are going to be your petrous portions, petrous ridges, and then you have A, which is the mastoid air cells. Okay? this is one of the toughest positions to do. So again, if the order asks for an SMV, you want to try, you set up your room first before placing your patient in that position with their head tilted all the way back. Okay, so you set up your room first. Position should be last. Okay. Let's talk about the orbits now. Is this your next slide?
No, there's one before it.
That one?
No.
Orientation.
Okay, I moved it. It got moved. Because I don't know how it ended up over there. So you'll see where I moved it. It makes more sense. All right, so let's talk about the base of the orbit. The base of the orbit is also referring to the rim of the orbit. And the bones of the rim is formed by the frontal, the zygoma, and then the maxilla. That is the rim of the orbit. Okay, if we look within the orbit, what do you think that one's going to be?
Which one?
This one right here. The sphenoid. So that's your sphenoid right there. So you have your sphenoid. What else are you going to have in this area?
Ethmoid?
Ethmoid, and what else?
Lacrimal?
Lacrimal. There you go, lacrimal. Okay. So lacrimal, sphenoid, ethmoid is going to form the rest of the orbit, but this is referring to just the rim or the edge. Okay. All right. So here we just basically answered all the questions here on the next slide. All right. So we have the sphenoid over here. Part of the orbit is also formed by the maxilla. You got the zygoma, frontal. And here we have, which bone is this?
Ethmoid?
Ethmoid, and then number one. We have number one, the lacrimal over there. And then palatine is a very, very small bone. Very small bone over here. Okay? But you see the orbit, they have a whole bunch of holes or foramens. This one in particular is the optic foramen, and this is where the nerve for seeing is, it's an extension of the retina that goes into that optic foramen that we'll talk about here in just a little bit. Then you have these other fissures or holes that are created where you have different nerves and blood vessels that gives the feeling, or gives, also gives blood supply to the parts of the face, your lips, your nose. And we'll get more to the specifics here, which is right here, okay? So you have the optic foramen, which is allows passage of the optic nerve, which is an extension of the retina. Then you have the superior orbital fissure for the nerves, 4 cranial nerves for the eyes and eyelid movement. The inferior orbital fissure are for the nerves for the cheek, the nose, the upper lips, and also the teeth. Now you have this very, very thin bone over here. Part of the sphenoid is called the sphenoid strut. This strut of thin bone separates the optic foramen from the superior orbital fissure.